Hey everyone, it's Heidi again. I hope everybody's still staying safe and making it through this as we reopen. Today I wanted to go over a case study with you guys about one of our patients that we have. So just bear with me, got a lot of back and forth going on between papers. So we have this patient who was born at 29 weeks and 4 days. So we use 29 weeks and 4 days or 29 and 5. And as the baby gets older, we don't just say 10 days old, because 10 days could be a 32-weeker that's 10 days old, or it could be a term kid that's 10 days old. And in turn, it's a big difference in what we expect out of them, how we're treating them, what they should be doing. So we always try to use their corrected ages instead of just saying the baby's 2 weeks old. This baby was born at 1,353 grams, so fairly small. Was born to a 24-year-old mom who is Gravida 1, Para 0. So Gravida is how many pregnancies they've had, and Para is how many live births. So this was her first pregnancy, and obviously she has no other live children. And mom came in on the 1st of April with premature onset of labor. So she was having contractions, and what they did was they gave her some steroids or betamethasone. And what the betamethasone does when it's given to the mom, it helps the baby's lungs to mature faster if they are an imminent premature delivery. They also start them on magnesium, and magnesium is given to help try to stop or slow the progression of labor. It also can help prevent injuries to the baby's brain. And we all know that IVH is premature babies are a huge risk for IVH. So, but research has shown that magnesium does not help to stop labor very well, but it does help slow it down. So it buys them time to try to get a full course of the steroids in, which is usually 2 doses, and we like to give them spaced out. So in turn, the baby's lungs will have a better chance of functioning appropriately. Obviously, she stayed in the hospital. On the 3rd, her membranes ruptured, so her fluid or her water broke. And then a week later, the baby's heart tones, they were doing their normal heart tone check, and the heart tones were down, so they decided to do a C-section. When the baby was born, some other medications that they gave the mom was also on ampicillin, azithromycin, and amoxicillin. And these are all 3 antibiotics. They try to help if the mom has an infection, which she was ruptured for a week before the baby was born. So there's a chance that there could be some infection from that. And also mom was GBS positive. And what GBS positive means is that mom is a carrier for the group beta strep. It doesn't mean that she's infected. It doesn't mean the baby's going to be infected, but it means she's a carrier, so there's a chance. So they usually give antibiotics to the mom to help prevent transmission to the baby and help decrease the chance of infection, which in turn can cause a whole another risk of complications. So they usually treat mom preemptively, and then if we get a baby that's born premature, the mom is GBS positive, typically we will treat the baby as well. So the baby came out fairly active. Of course, we're dry stimulating, suctioning, all that. He started grunting, which is that sound. He's trying to keep his alveoli open and try to breathe on his own. And he had some slow respiration, so that was ineffective. So PPV was started, and then the patient was intubated and was transported up to the NICU. So in the NICU, baby was placed on a ventilator, and then UAC, or an umbilical artery catheter, and a UVC were placed. So with the UAC, well, let's talk about the fetal circulation. Bear with me.